So today I thought it might be helpful if I share 5 non-medication based ways to help with constipation. So lots of people seem to be pretty confused with constipation and what it actually means. So you don't actually have to do a poo every day to be not constipated. So by definition, you are constipated if you go to the bathroom less than 3 times per week. And if you have a difficult time passing a bowel motion, or if it's a real strain to go to the bathroom. Now, I will interject and say that actually you can also have diarrhea when you're constipated. And I know that sounds like it doesn't make a lot of sense, but if you manage to get yourself really constipated, you can have what's called a fecal leak. I know it doesn't sound very nice, and it's not very nice, to be honest, but it just means that you've got lots of very, very firm stool in your bowel and you're getting a leak of liquid around it. So sometimes people think that they've got diarrhea, but actually what they've really got is constipation. So that just adds to the confusion. So what are the symptoms of constipation? Dry, hard stool, needing to strain to pass a bowel motion, feeling pain or discomfort in the tummy or in the back passage, feeling like when you've gone to the bathroom, you haven't actually managed to empty your bowel. And some people, whenever it's severe, will complain of a fullness in their rectum or a feeling like they've got a blockage. So obviously most of you will know that we focus a lot on diet and hydration whenever it comes to constipation, but there are definitely other things that can really contribute to you having a problem with constipation. So there are medications that can definitely make constipation a lot worse. So they include things like painkillers, particularly ones that have opioids or codeine in them. And if you think about it, the old-fashioned remedies for diarrhea used to involve taking codeine. So codeine really makes the bowel a little bit lazy and slows everything up. So that's one of the reasons that painkillers, if you've had some surgery or you've got an injury and you're taking painkillers, you might find that you're getting pretty constipated. Some of the blood pressure medications and some antidepressants can also make you constipated as well. Food allergies. I definitely have a number of patients who notice whenever they have certain foods, they're more constipated. So some people are very sensitive to dairy, and they'll find that if they've had a lot of cheese or a lot of dairy products or ice cream, that they'll find that quite constipated after that. Some people find with gluten, they get quite constipated. So they're not necessarily celiac, as in very, very allergic to gluten, but they're sensitive to gluten, and it can make you constipated. So sometimes it can be worth just trialing, holding back on some foods to see if it makes a difference. Other conditions that can cause constipation are things like irritable bowel syndrome. So some people have a very constipated type of irritable bowel. Some people have a lot of diarrhea, and some people have a mixed version of irritable bowel, but that's definitely an issue. Another group of people who struggle with constipation are actually diabetics. So there's lots of reasons why diabetics can suffer from constipation. But as we know, the high sugars that you get in diabetes damage nerves, and it would seem that they can damage the nerves to the bowel, making the bowel work much more slowly. Other neurological conditions like multiple sclerosis can also cause this sort of similar situation where the bowel becomes very, very sluggish. And Parkinson's disease is another issue. So if you have a friend or family member with Parkinson's disease, it can be really worth thinking about their diet and potentially even laxatives on a regular basis just to prevent this problem. So I said at the beginning I was going to give you 5 options to try before we go down the medication route. And one of them I want to talk about a little bit. Number 1 is a poop stool. So I know it sounds a little bit weird, but if you think about it, in the Western world, when we sit on the toilet, we're sort of sitting at 90 degrees. Whereas if you look at populations who squat to use the bathroom, they're sitting at a completely different angle. And I have to admit, when I first saw these poop stools, I wasn't sure whether there was much science behind them, but actually the science is really very robust. They've done lots of studies, and believe it or not, they've x-rayed people and done all sorts of scans with people in different positions. And they've shown that whenever you're sitting on the toilet, if you have your feet and ankles raised up on a stool, so that your knees are higher than your hips. It absolutely changes the angle that the rectum is sitting at, and it also relaxes the sling muscle that holds the rectum closed. And they've also shown that people who use this position to use the bathroom actually have to create a lot less pressure in their tummy to be able to go to the bathroom. So there's lots of health advantages of that, including having a decreased risk of things like hemorrhoids. And if you've ever had hemorrhoids or piles, that they're sometimes called, they're very unpleasant. So anything that we can do to avoid those is helpful. Now, the other one that you will all know is water. We know that if you don't drink enough water in the day, your body goes, oh, okay, I haven't received enough hydration today. And what it does is it goes to your large intestine and it actually sucks some of the water out of the contents of your bowel and uses it to top up what it hasn't received. That's in really simple, basic terms. And so therefore, make sure you drink plenty of water so your body doesn't need to do that. Because when it does that, it dries out the bowel motions and makes it really, really hard for them to move through the gut. The other thing that people often think is that their intestines are just this big string of sausages in their tummy, not doing much. But actually, they're moving constantly. I often think of it a little bit like a snake slithering along the ground, or a caterpillar. It's got that kind of flowing movement. But what we know is that whenever you've got a very sedentary job or a very sedentary life, that movement becomes much, much less. And we actually need that movement called peristalsis to actually push everything through the gut. So remember, when you eat, it has to move its whole way through meters and meters of intestine until you poop out the waste bit at the end. So exercise every day, moving every day, even if it's only a 20-minute walk, makes a big difference. The other one we talk about is increased fibre, and this can be easier said than done. Of course, we always would love people to get enough fibre every day in terms of fruit, veg, nuts and beans. But the reality is that some days it's just really hard. Sometimes you're busy, you haven't planned your meals that well, you're away from home, and it's just really hard. So I think it is okay to actually just accept that sometimes it is tough to get that through food, and accept that you're not going to, but have another strategy up your sleeve. So buying one of these husky fibre drinks, that's really helpful. You can buy them in sachets in all chemists. You just make them up in some water. Just having one of those every day to make sure that you're getting enough fibre is really, really helpful, and is going to really help you if you are constipated. And the final tip is time. And what I mean by that is two things. One, giving yourself time to go to the bathroom. So lots of people, including kids, for example, hate going to the bathroom at school. And so they'll get the urge to go to the bathroom, but they don't want to go to those stinky school toilets. And therefore, they'll just keep holding on and holding on. And eventually your body decides, oh, well, when I need to go to the toilet, you just ignore me. So it just stops telling you that you need to use the bathroom. So I think it's very, very important that you give yourself time, particularly after eating a meal. There's actually a really strong urge and message goes from your brain to your bowel and your rectum whenever you've just eaten to say, I've just taken in some more food, so it's maybe time to make room. So it's trying to take that time. I often recommend parents get their children to go to the bathroom before they leave for school, after breakfast. Let them go and have a look at a book or a magazine or scroll on their phone if they need to, but just to try and let them get into the habit of going to the bathroom. Because believe it or not, you can actually train your bowel that most of the time you know when you're going to go to the bathroom. So one of the commonest questions that I've got asked since we've begun recording podcasts are, what do I do with myself at my clinics, apart from when I'm working as a GP in my GP clinic? So at my clinics that are called You by Dr Shauna Watts, the clinic is centered around you, and it's all about making everyone who comes, but that's mostly middle-aged women, feel more confident, and to help people navigate what I find is the overly complicated world of skincare. No one knows where to start, what's real, what's not, what's going to help, what's not. Various treatments in terms of wrinkles and skin laxity and skin tightening and pigmentation and discoloration and what they should have and whether it'll help them. So basically my role in that is to create a bit of a plan and a journey for you to get you to the point where you're back feeling confident and healthy and happy in the skin you're in. The clinics are based on the Central Coast and in Newcastle, and we would love for you to come and visit us and have a no obligation consultation to see where that journey might take you.